So these are exercises for strengthening the knee, for people with meniscus problems or ACLs, so either before surgery or after surgery, so you can strengthen the quad. So you want the leg lifted a little bit, so you want to support the leg a little bit, and then the exercise itself is lifting the leg, pointing the foot, flexing the foot, and lowering. So mechanically it's just up, point, flex, and down. But this is just the mechanics, and what you're actually wanting to do is activate the quad. So what you want to do is lengthen the heel constantly as you're pushing out. Lengthen towards the toe. You don't have to point the foot. This is fine. Then as you flex the foot, lengthen the heel away, and especially as you're lowering, lengthen the heel down, lengthen it away as you're lowering as opposed to just dropping it. So lengthening, lengthening even more, lengthening even more, and lengthening even more constantly. So you're really activating the quad. And the other trick is most of us are going to tend to kind of sink down as soon as we lift the leg. The whole point is to keep yourself up as you're lengthening the leg out. You want to do that about 10 times. If you can add a weight on. So this is 3 pounds is perfectly fine. You don't really need more. And when you feel comfortable with that, you really have it constantly activating the quad, especially as you're lowering. It's almost like you're lifting the knee in order to lower. Okay? So that's number one. Doing this about 10 times, constantly elongating, so you're strengthening the quad. Another exercise would be to just foam roll on the side, on the IT band, as well as the quads. So we're actually better off on the floor. So you're just walking yourself up and down on the IT band, and then you can roll down so you get the quads as well. And the third exercise is it's just bicycling. And you want to bicycle, if you can, do it rather than a stationary bike, on a road bike, because you want to get the weight on the leg. Most stationary bikes are kind of here in the front. You want to get the weight going into the leg so that both the hamstring and the quad get activated, so you're bicycling this way as opposed to that way. So those are 3 recommendations for knee pain problems.